gentlemen, good evening. My name is Barb Milden, and as CNA's President-elect, it is my great pleasure to welcome you to the 2012 Biennial Convention of the Canadian Nurses Association. Welcome. To the members of the Vancouver Chinese Lion Dance Association, thank you for leading the procession. You have provided a vibrant and a memorable welcome to the nurses of Canada gathered here in Vancouver for the next few days. Thank you again. I would also like to thank our flag bearers, and may I say I am so proud of them. Kate Hodgson, Patient Care Team Manager at the Seven Oaks General Hospital in Winnipeg, Manitoba. Janet Ray, Healthcare Consultant for Janet Ray Consulting. Claire Maltzed, second-year nursing student at Trent University. And Jody Meacher, third-year nursing student at the University of British Columbia. Please stand and be recognized. I would now like to introduce the members of CNA's Board of Directors, who collectively represent nearly 147,000 RNs in this country. Their duty is to provide leadership and guidance for your association, CNA, the national professional voice of registered nurses. And I can tell you that they carry out that duty with passion and with pride. I ask that you please hold your applause until all have been introduced. Judith Shamian, President. Susan Duncan, President, Association of Registered Nurses of British Columbia. Diane Dyer, President, College and Association of Registered Nurses of Alberta. Candice Hennepin, President, Saskatchewan Registered Nurses Association. Robin Finley, President, College of Registered Nurses of Manitoba. Rhonda Seidman Carlson, President, Registered Nurses Association of Ontario. Franz Marquis, President, Nurses Association of New Brunswick. Judy Bailey, President, College of Nurses of Nova Scotia. My apologies, College of Registered Nurses of Nova Scotia. Marilyn Barrett, past President, Association of Registered Nurses of Prince Edward Island. Bev White, past President, Association of Registered Nurses of Newfoundland and Labrador. Robert Nevin, President-elect, here for the President Angela Luciani of the Registered Nurses Association of the Northwest Territories and Nunavut. Peggy Haynen, past President, Yukon Registered Nurses Association. Claire Betker and Judy Boychuk-Ducher, Associate Member Representatives. And Evan Jolicoeur, past President, Canadian Nursing Students Association. Joseph Mappa and Vincent McLean, public representatives, are unable to be with us tonight. Board members, please stand and be acknowledged. I am very proud that standing beside me and sharing the stage is CNA's Chief Executive Officer, Madame Rachel Bard.
Thank you, Bonsoir. As you can see, I had to do the trick again. I became visible by climbing on a little stool, so it's always a challenge. Mais bonsoir à tous. Il me fait vraiment plaisir d'être une des autres pour cette belle soirée ce soir qui ouvre l'ouverture de notre congrès. It is my pleasure this evening to recognize the executive directors and chief executive officers of CNA, provincial and territorial jurisdictional members. As my colleague said just a few minutes, I will ask that you please hold your applause until everyone has been introduced, and then that will be possible. So I will start first by inviting Nora White, Project Manager of the Association of Registered Nurses of British Columbia. I don't know if she's here. Ah, right there. Perfect. Marianne Robinson, Chief Executive Officer of the College and Association of Registered Nurses of Alberta. She may be joining us a bit later, so we'll see. Karen Eisler, Executive Director of the Saskatchewan Registered Nurse Association. Diane Wilson-Maté, Executive Director of the College of Registered Nurses of Manitoba, had to leave earlier. Doris Grinspan, Chief Executive Officer of the Registered Nurse Association of Ontario. Roxanne Tarjan, Executive Director of the Nurses Association of New Brunswick, l'Association des infirmières et infirmiers du Canada, du Nouveau-Brunswick. Donna Dene, Executive Director of the College of Registered Nurses of Nova Scotia. Becky Gosby, Executive Director and Registrar of the Association of Registered Nurses of Prince Edward Island. Peggy Earle, Executive Director of the Association of Registered Nurses of Newfoundland and Labrador. Sheila Humphrey, Acting Executive Director of Registered Nurses Association of Northwest Territories and Nunavut. Catherine Bradbury, Acting Executive Director of the Yukon Registered Nurse Association. Executive Directors and Chief Executive Officers are now for you to be applauded. We are honored to have with us this evening some of CNA's past president and executive directors. Alors, un gros merci d'être parmi nous. And I invite you to stand and be recognized. So all of the past president, certainly an executive director, please stand to be recognized.
I also invite the past Jean Mance Award recipients, Canada's highest nursing honours, who are with us this evening to stand and be recognized. It gives me great pleasure to acknowledge the participation of representatives from our federal and provincial governments. The Honourable Hetty Fry, Member of Parliament for Vancouver Centre; Joan McIntyre, Member of the Legislative Assembly for West Vancouver; Mike Farnworth, Member of the Legislative Assembly for Port Coquitlam; Sandra MacDonald-Renz, Executive Director of the Office of Nursing Policy at Health Canada, and all the Principal Nurse Health Human Resource Advisors of the provinces and territories. Please stand and accept our warm welcome.
We're also fortunate to have some of our international colleagues here this evening. The International Council of Nurses, David Benton was with us for most of the last few days and had to return, but he was here in presence. And also we have the Vice President as well from the International Council here. Sigma Tau International Honor Society of Nursing, as well as the National Council of State Board of Nursing. So please stand to be acknowledged. Also with us this evening are numbers of invited guests representing healthcare organizations in this country. Souhaitez, s'il vous plaît, la bienvenue à the Canadian Association of School of Nursing, the Canadian Council of Practical Nurse Regulators, the Canadian Federation of Nurses Union, the Canadian Medical Association, the Canadian Nurse Protective Society, the College of Registered Nurse of British Columbia, the College of Registered Nurse of Ontario, and the Canadian Nurse Foundation, who is celebrating its 50th anniversary. Congratulations. I hope that some of you were part of the festivities last night, actually, to celebrate the 50th of the Canadian Nurse Foundation. So thank you very much for all of you to have participated and coming tonight, and please stand and be recognized for a great hand of applause. We have also, and my apologies because I saw this gentleman actually part of the day today, Frank Schaffer from the International, let me just hold on here. Now you know my age. It's actually the organization of the credentialing of the CGFNS, which stands for the Credentialing Graduate Foreign Nurses Society. So welcome as well.
One of the highlights of our first few days here in BC has been a new name for our associate, affiliate, members, and emerging groups, which we used to call AAEs. Now I'm able to tell you that we have 43 members of the Canadian Network of Nursing Specialties. Congratulations. These 43 groups represent over 44,000 nurses and nursing students. We value your ongoing support and look forward to your active participation in this convention. Some of you have taken the opportunities to hold your own meetings while many of your members are here in Vancouver for this biennial convention. We wish all of you continued success, and we thank you for your engagement, your vision, and your hard work on behalf of your specialties. On May 10th, CNA announced the winner of the 2012 CNA Employer Recognition Award. This prestigious prize honors employers who have shown an exceptional commitment to supporting registered nurses pursuing and maintaining national certification in a range of nursing specialties or areas of nursing practice. Employer support on that journey is critical to success, and that's why we recognize exemplary organizations year after year. As healthcare treatments, technologies, and practices are always evolving, it's important to ground nursing work in evidence and in education. Ultimately, these employers are helping to enable nurses to deliver the highest possible quality of care to Canadians. This year's top award winner is the not-for-profit Hill House Hospice of Richmond Hill in Ontario. Half of the 8-person nursing staff has obtained CNA certification. Hill House Hospice supports certification candidates by providing exam study materials and time off for exam preparation. The facility also offered compensation for 60% of the exam cost. But with the majority of the hospice funds coming from direct donations, the nurses chose to cover their own costs through other means because they wanted the resources to stay directly in patient care. Please help me recognize Hill House Hospice of Richmond Hill, Ontario. It is now my great pleasure to invite all certified nurses to stand and be recognized. These certified nurses are easily recognized by the dark red ribbon hanging from their name badge. If you aren't a certified nurse yet, please speak to one of them about the value of their certification. They are our ambassadors for this very important program.
And now, I wish a warm welcome to the future leaders of our profession, les étudiantes et étudiants en sciences infirmières, the nursing students who have joined us here in Vancouver, and I would ask them to also stand so that they can be acknowledged.
And as I say, because I can't help but say it, thank you for choosing nursing. I have the honor this evening to introduce Joan McIntyre, member of the Legislative Assembly for West Vancouver, Sea to Sky, who was with us today to bring greetings on behalf of the Premier of our host province, the Honourable Christy Clark. The importance of investing in community population health needs is something that MLA Joan McIntyre understands very well. First elected in 2005, Joan chairs the legislature's Standing Committee on Children and Youth and also serves on the Cabinet Committee for Families First and was on the Standing Committee on Crown Corporations and Public Accounts. She served as Minister of State for Intergovernmental Relations from June 2008 to June 2009. Before entering provincial politics, Joan co-founded the polling firm of McIntyre and Mustel Research Associates Limited, and also then worked as an independent consultant, focusing on the qualitative side of the research business. Joan lives the philosophy of active living as a skier and a sailor. She grew up in Toronto, Ontario, and attended the University of Toronto's Trinity College. She graduated with an Honours BA in Political Science in 1971. Joan and her husband, Andrew Pottinger, have lived in West Van since 1983, and they have 2 children, Lee and Drew. Please join me in welcoming MLA Joan McIntyre to bring greetings from the Government of British Columbia.
Thank you, and good evening, bonsoir. As I've been introduced, you all know now, my name is Joan McIntyre, MLA for West Vancouver and Sea to Sky. And I'm very pleased to bring greetings on behalf of our Premier and Health Minister Mike Young, who unfortunately had to send regrets. So I say welcome and bienvenue à Vancouver. And I was hoping actually that some of you may have had a chance to experience some of that bit of sun we may have been having recently. So we have a running gag here in British Columbia because the province, we love to take credit in the beautiful sunny Vancouver days, and when it rains, we blame the federal government. So with apologies to Dr. Hetty Fry if she's here. But anyway, kidding aside, we're very pleased and excited that you have chosen Vancouver and beautiful BC for your annual meeting and biennial convention. We've invested significantly in our infrastructure in British Columbia, in our infrastructure and tourism initiatives, especially as we had the honor a few years, although I cannot believe it's a few years ago now, of hosting the 2010 Games. And so hosting hundreds of Canadian nursing colleagues this year is most appreciated. And speaking of government investments and government initiatives, I want to reassure you that we in British Columbia firmly believe that nurses are vital partners in providing expert input into health policy and strategic directions for government. And we're very proud of the significant role that nurses play in our healthcare system today. In fact, I was very interested to learn more about your A Call to Action report and its 9-point plan that I realized was just released. Because I think there's no question that nurses have both a significant role to play in determining how we need to adapt healthcare delivery in this country, as well as a large role in delivering those services sustainably. And in particular, I think maximizing working to the full scope of practice, a principle which we support here in British Columbia for all healthcare professionals. I'm pleased to say that over the last decade or so, our government has invested more than $200 million through the BC Nursing Strategy to educate, to recruit, and to retain nurses. And the province has added more than 4,400 nursing education spaces, more than doubling the number since 2001. So I was very pleased to see the students are here, and I wanted to add to the comment about thank you for going into nursing. We need you. We've also created 26 new nursing education programs at public post-secondary institutions in the province that include practical nursing, registered nurse, psychiatric nurse, nurse practitioner, and other graduate nurse programs. And the number of registered nurses with a practicing license in BC has risen to nearly 36,500. So I think you should give yourself a hand. With more than 7,000 additional nurses practicing since 2001, it represents an almost 25% increase. And I think that's terrific, really. And I just wanted to share with you tonight, I have a personal and professional connection to BC nurses that goes further back than what I've been talking about, to the days when my market research and polling firm was privileged to have the BC Nurses Union as a client. And it gave me a very up-close look at the number of issues that your profession was dealing with then, and I'm sure we've added to that, but I'm sure many of the issues are similar. And it gave me the insights to really, I think, form a basis of what I feel is a very, very great respect for the work that you do for all of us each and every day. And it's one of the reasons I'm very proud of the work, actually, that our government is currently doing with nurse practitioners, because the province is taking steps to provide more opportunities now for nurse practitioners to be fully integrated into the healthcare system here. Back in 2005, the idea and the plan was to have these health professionals fulfill additional roles in areas like primary care, which I know is of great importance to you, but also in chronic disease prevention and health promotion. And since the role was introduced, the nurse practitioners have now shown that they can help in improving timely access to individualized, high-quality, cost-effective care. And government is also continuing to listen to the nurse practitioners to hear what could be done to improve and provide better health outcomes and provide better health care. That led to a recent government announcement that it's funding 190 nurse practitioner positions over the next 3 years. And the good news is that that $22 million plus Nurse Practitioners for BC initiative will begin this very fall. So again, I'm very pleased that you've chosen Vancouver for your conference. I'm confident you're going to have a lot of interesting discussion the days ahead, particularly with regard to a call to action and all that that will entail. So thank you again very much for having me bring the greetings from the province, and I really wish you every success in your conference. Enjoy your time and enjoy Vancouver. Thank you.
Well, thank you very much, Madame McIntyre, for bringing a message from the government of British Columbia. And we're certainly pleased to see the commitment to advancing certainly nursing services in the province. And I'm sure that ARNBC will most likely be visiting to be a partner and introduce our action, certainly the call for actions, the report that we've just received today. And now, it's a very special moment for me, as our next speaker is a tremendous individual who has given so much of herself to CNA for the past 2 years. I am, of course, referring to Dr. Judith Shamian. Judith has been an inspiration, a leader, a powerhouse, and in all the names in advancing the cause of nursing. We have all benefited from our relationship with Madame Présidente, but I have especially benefited from her friendship, her candor, and her wisdom. And tonight she is here to share her thoughts in these last few days as president, because I know she's been counting them, even though she's loved every minute of the 2 years she's done. I couldn't keep up, and I thought I was fast, you know, but I can't keep up with this lady. So I would invite, actually, Judith to share with us some of her last few messages to us. So please help me to welcome Dr. Judith Shamian.
Hi. So the choices you make when you have your last opportunity to deliver a speech is whether you're going to do a major policy speech or do something else. And guess what? I'm doing something else. I think that both as a board and the community of nursing and community of healthcare, we have spent a tremendous amount of time over the last few years talking about policy, talking about issues. I couldn't match what we had today from the commissioners with the call for action and with other policy discussions that the board had over the last 4 or 5 days. So I am truly going to try to reflect on what have transpired and what are maybe some of the challenges ahead of us. And I am going to talk to you about GPS. And you will never be able to look at GPS again in the same way as you looked at it until today. Because if you think of it, it is really global positioning system. Haven't we talked about global positioning and systems? So I want to talk to you about how I saw the GPS of my presidency in the last 2 years, and I will be calling you to think through your GPS in the coming months and the coming years, because we all need to do a lot of work around global positioning of the system. So what the G stand for? Yes, it stands for global, but for me, the last 2 years, it also stood for what were my goals? What did I want to accomplish? And my accomplishment, as many of you know, and you literally can recite it, I believe in the rules of 2 or 3, so you can remember it, just like GPS, it's only 3 letters, is engagement and Medicare. Those were a few of my very strong goals. I wanted us to see, my goal was the best healthcare, the best care, and the best nursing. And we heard tons about it, and we will hear more tomorrow and as we move through the coming days. But how did we achieve that engagement? And the engagement was within the nursing family, with nurses from coast to coast to coast and internationally, working with colleagues like the Canadian Medical Association, and I'm so pleased, Dr. Hagee, that you are here. We have spent tremendous amount of time in moving the healthcare agenda forward, and the Canadian Medical Association and the Canadian Nursing Association has learned how to work through issues and work collaboratively, because we are both very committed to transforming the healthcare system in this country. The goal of having the best healthcare system is very clear to both CNA and CMA, and the collaboration has been terrific. I do not intend to exclude many other partners, but the collaboration that we have been able to build with others is tremendous. The collaboration and the engagement with the Council of Federation was just terrific. I think we understood, and I understood, that first and foremost, the major providers of this country have to come together. And that's where building the relationship with CNA and CMA was so significant. Then we knew that in spite of the fact that nurses and doctors have developed principles for transformation, and we have over 120 groups that signed up for it, we need more than that. And we needed to get the politicians in our camp to be able to move that agenda forward. And when the politicians met last August, actually I think here in Vancouver, we wanted to come and see them. And the answer was, no, 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 no. We don't get anybody to come and meet with us. This is our meeting. We could have walked away, but we don't, because we understand the goal of what this is about and what we needed to do. As we went across the cross-country, as again part of the engagement, we have met with multiple premiers and so on. And I think it was in Winnipeg where the premier said to us, why don't you come and just have a reception? We will come. You couldn't come into the room because that's our practice. But why don't you have a reception and we will come? Which we did in December or January, whenever that was this year. And they did come. We had most of the premiers and those that couldn't make it because they weren't in Victoria yet. They came, their delegates came. And Dr. Hagee and I stood in front of a podium like this one, and we're very clear that we want to be part of the solution because we need to transform this healthcare system. And went through some of the facts that we have heard today, that we are the 6th most expensive, but our outcomes is really far behind, and that's not good enough. Canada needs to do far better. And we said to them, we want to be your partners. We will take some of the bullets that politicians are difficult to take, and so on. And then we sat and waited. Those of you who know me, waiting is not my good quality. But we waited, and it didn't take more than 24 hours, where they came back and said, we would like to consider the innovation committee approach working group. Would you partner with us? And both CMA and CNA said yes. That's why we are here, not to drink the Kool-Aid. We are here to be able to move this agenda forward. The rest is history. The work that CNA has done, the work that CMA has done, just fabulous. And many members of the jurisdictions like Donna Denny, RNAO, and others have really participated into it. Is that going to transform our system? Is that going to take care of the 9-point action plan? No way. But is that an amazing step to get the premiers to work together and give us all hope to work together with nurses and doctors and the rest of society? Absolutely. So those were some of my goals, and some of the other goals were to keep everybody in the tent. And we all know the story about British Columbia and the regulatory body. And Madam Politician, please take back to your Premier and to the Cabinet that what British Columbia has done in establishing a nursing association in such a short time, based on volunteer commitments, has not been seen in this country for many decades. There is a lot to be celebrating in British Columbia. And mark my word, yes, I am finishing being a president, but I'm not finishing being Judith Shamian or a nurse leader or a healthcare leader. We will not allow any other jurisdiction to be left behind. CNA is here to be the family of the nursing community, to deliver the health care and to advocate for the healthcare system that we all need. So that's how we moved around the goal. What happened to the P, which is position, politics, principles? Principles are very, very important to me, and many of you have heard us talk about it. As long as we come from the same value base, everything can be worked out. The minute you don't come from the same value base, then things fall apart. So the position is very important, and the principles and politics. And how did we do that? Sometimes we pushed, sometimes we pulled. But as many times as we could, we partnered. So the partnership, the push, and the pull, and all of that collaboration takes us to the position that we want to be. Again, I mentioned the Federation, the Council of Federation, CMA, CRNE, and other issues that we push when we need to because we believe in the principles. We pull when we need to, and we hunker down and partner and collaborate when we have to. So again, we understand the goal, and we understand that there are different positions one needs to take in order to move forward. So the GPS is on its way to pointing the directions we need to move to. So what happened to the S, which is the system? It is about the system that we look at. And it is about the global system, not just how I'm going to get from my address to the next address, but the global, which is the universe. And I think as CNA plays its role with ICN, and each and every one of you play your roles in the international arena, we do understand what global means. And global is very local, and global is very global. And everything in between is linked. And we didn't used to think so, but the more we spend time and energy to look at it, that global system linkage is tremendous. So we cannot just hunker into our jurisdictional effort or professional specialty effort. It is our responsibility to look at issues in the pan-Canadian and the international arena and figure out how we move forward. One of the questions that we discussed, and I asked Marlene, who was the co-chair of the commission, how do you see it relevant to international? And her answer was simple. It is all relevant. And we had, as Rochelle said, David Benton, who is the CEO of the International Council of Nurses, that basically was so pleased with the report and have commented that while there are many reports out there, this is the only one that he is aware that it is so much about serving society and serving Canadians and looking at it from that perspective. But that's what nurses do. We also come at it very much from the social responsibility. And we all know from our research that nurses oftentimes put their own health ahead of their patients' health because they feel socially and morally responsible. So as you can see, my GPS was very clear for the last 2 years. The GPS of the nursing community and the GPS of CNA and the global community is pretty clear. Let me just summarize very quickly. We have both the responsibility and the privilege of caring for Canada's health. We were told this morning by Maureen, Canadians expect nurses to use their power. Canadians expect nurses to use their power. I had the privilege to sit on a bench on the Trent River with Tom Jackson. Some of you might know who Tom Jackson is. He is a Canadian singer and an Aboriginal advocate. He's also a chancellor of Trent University and an unbelievable Canadian. When he was growing up on the One Arrow Reserve in Saskatchewan, he would watch his mother in tears over the pain and suffering in their community and in the world. And he told me, as I grew older, I came to realize that it wasn't the burden of all that suffering that she was wearing. It was a crown. She wore the crown on her head as the person who cared for everyone and wanted to make a difference in this world. He told me, and we were sitting on that bench on Trent River on the day of the graduation of the nursing class in Trent University and some others. And he told me that nurses wear the same crown. It symbolizes what we do, what we give to the country. It is a crown we should wear with great pride for the amazing work we do and how constantly and deeply we care for Canadians. And I am going to demonstrate for you the crown. When I did my opening speech 2 years ago, I said I will be stubborn and disagreeable. So in closing, I am doing the crown thing. But seriously, there is no doubt that nurses do amazing work. 260,000 plus times over every day. And we touch millions of lives. But we need to push this one step further. But this goes one step further and further and takes the communal responsibility so that our success is doing us out of the work that we do every day. And I do believe that the report that we got from the Commission is the roadmap to make that happen. This is a crown the public has put on us with the immense trust and respect they have for us. The respect that they have for registered nurses. Now let's wear that crown with the conviction and courage needed to live up to what the public has put on us. So get your crown on and get on with it. Canadians are waiting. Over the next 2 days, decide what you will wear on your crown and what will be your GPS. Thank you very much.
Well, I guess, Madame Présidente, you will surprise me every time. We can be prepared as much as we want. You never know. So it's the first time, but I will never forget now what a GPS means. Certainly a new definition. Really, Judith, thank you very much for your presentation and your message tonight. I think that it is giving us some great inspiration. And I'm sure that during the course of this convention, many of you will take the opportunity to actually thank Judith personally and maybe also ask a few more of her inspiration. Because I think that it certainly gives us, great motivation to see that what leadership and the tremendous contribution that you have done and provided to advancing the nursing profession in Canada. So again, thank you. Alors, il me fait grand plaisir de remercier à la fois tous nos partenaires du Congrès. Votre généreuse contribution et appui nous permet d'offrir un programme dynamique et de qualité. On behalf of CNA and its Board of Directors, I would like to acknowledge and thank our partners. TD Meloche-Monex Insurance, l'assurance TD Meloche-Monex, Canadian Nurse Magazine, la revue infirmière canadienne, Extra, the Executive Training for Research Application Program, Nurse One, Infusion, Pfizer Canada, Johnson & Johnson Family of Companies, LifeScan Johnson & Johnson, Canada Health Infoway, InfoRoute Santé Canada, and the University of Calgary, Qatar. Before we move into the social part of tonight, though, I would like to certainly take just 1 minute to applaud all of our contributor and supporter and sponsor for tonight. And the company. And not only for tonight, but also during all of the Congress. Before we move then to the social part of this program, just a few more announcements. You may have noticed that you did not receive a convention bag at the registration desk. I found out about this as well today, and usually it's a tradition, but this is one of our first time that regretfully we do not have beautiful design bags that had been prepared. Apparently, there was a problem in the solvent that was used, and therefore it is generating a smell. And even after 4 days of being outside, it is still not acceptable. So we're very sorry for this inconvenience, but I guess we decided that it was best to respect the environment and certainly not entertain these bags for this year. L'AIC reconnaît que certaines personnes sont sensibles aux allergies, aux parfums et autres produits parfumés. Therefore, out of respect for the attendees with allergies, we do ask that participants refrain from using perfume, scented hairspray, cologne aftershave, and many other scent products, just again, to respect the environment and the sensitivity. So over the next few days, you just want to keep that in mind. Ensuite, en tant qu'organisme bilingue, nous vous offrons bien sûr l'interprétation simultanée. Therefore, as a bilingual association, some of our presentations are en français, while others will be in English. So simultaneous interpretation is being provided. Please remember to bring your audio receiver to all sessions and to return it to the AVW TELAV Audiovisual Solution table before you leave on Wednesday. Otherwise, I think you will have a little challenge because they will need their equipment back.
And just a few more housekeeping items. Name badges are your access to all sessions. Please wear them proudly. And please note, if you are attending tomorrow evening's award gala banquet, your banquet ticket will be required at the door. No one will be admitted without their ticket. We encourage everyone to take a few moments and pre-select your seat for the gala. All you need to do is go to the seating map located near the registration desk, where staff will assist you in reserving a seat. And believe me, it's much better to walk into that room knowing where you're going to be.
And we have a few fun activities for you to participate during the convention. The first is to take part in the Canadian Nurse Magazine photo project by telling the world why you are a registered nurse. Visit them at booth 9 throughout the convention.
Secondly, you will notice CNA's roving reporter, dressed noticeably in a bright pink shirt, with roving reporter on the back. During the opening reception, breaks and lunches throughout the convention, Sue will be accompanied by a videographer and will be walking around asking you for your opinions and stories in a man-on-the-street style. Maybe I should say a nurse-on-the-street style. She will be interested to know things such as, you're a registered nurse, so tell me what you do. What does being a certified registered nurse mean to you? The mini interview will take about 1 minute. The video clips will be used for web content for various CNA campaigns, including the upcoming RN Awareness campaign that we'll be launching this fall. We hope you will share willingly.
And thirdly, tonight only, vous pouvez être une vedette du Congrès. You can become one of the convention big screen star. So you'll see, we want you to share on video about in 30 seconds or less who you are, where you are from, and something inspiring about being an RN. So maybe other acronyms that will come out. Throughout the convention, these video clips will be played on the screen for all of you to enjoy. Visit the same booth, the famous number 9, for your moment of fame. And finally, CNA is thrilled to be engaging with nurses and others throughout our Twitter feed. There is a large screen TV outside the room dedicated to Twitter messages. We hope that you will tweet often.
2012 is an important year for BC nurses as they celebrate 100 years of professional association. And what better way to celebrate a birthday than with cake? Now, I might argue with that because it was pretty special to have 38 delegates in those seats today. But there will be cake in the foyer, so please be sure to visit and get your piece of cake. Happy birthday, BC Nursing. I'm now pleased to introduce, representing the LifeScan Johnson & Johnson, tonight's reception partner, Dr. Lesha Babiak. Would you please come to the podium?
Thank you. It's been a fabulous reception. We heard some really terrific inspirational messages from the government of British Columbia, which was really welcome, but also from your leadership of the CNA. Really inspirational. Thank you. As the opening reception partner, LifeScan, which is one of the Johnson & Johnson family of companies in Canada, we're committed to the role of RNs in today's changing healthcare environment. This is embodied in our credo and our mission. LifeScan is rooted in the Johnson & Johnson credo, which outlines our first priority to the families and healthcare professionals who use our products. We take this commitment seriously, and in fact, our company mission within LifeScan is to create a world without limits for people with diabetes. Thank you for allowing LifeScan and also Johnson & Johnson family of companies to share in this very special convention. And I understand that this concludes tonight's opening ceremonies, and I would welcome you to join us for cocktails and appetizers in the foyer and also in the exhibit hall. Have a great evening and also great convention.